Did you see the recent New York Times publication about low-carb diets and their health effects? It was mostly the negative health effects. But here's a question. Did they interview anyone experienced or trained in ketogenic therapy? Nope. Did they even attempt to provide balance by discussing the potential therapeutic benefits of ketosis? No, not really. And this matters. It matters deeply to the many people who are trying to improve their metabolic and mental health. Those with insulin resistance, type 2 diabetes, PCOS, fatty liver, and even many psychiatric conditions. For them, a balanced and informed discussion of carbohydrate reduction truly matters and was completely missing from the New York Times article. But don't get me wrong, the article does get some things right. For one, they focus on the importance of the type of carbohydrate, focusing on more whole food sources. And for some people, that approach is great. But they completely discount that the amount of carbs can also matter profoundly for many people. The article also leans on nutrition epidemiology to raise alarms about saturated fat and red meat, the same old story. And again, ignoring that reducing carbs, for one, doesn't mean you have to eat more red meat or saturated fat. But even if you choose to, there actually is no data that higher red meat consumption in the setting of a low-carb diet is harmful. In fact, there's the opposite data. So that's a nuance they completely failed to even consider. So it's clear what's missing from that article is a meaningful engagement with clinicians and researchers who actually use low-carb and ketogenic metabolic therapies in clinical practice. There isn't a single clinician quoted who brings direct experience with ketogenic therapeutic approaches. And that's a major gap because anyone who works with metabolic therapies knows both sides. They know the challenges and the potential profound benefits that some people experience from ketogenic therapy. And remember, ketosis is the metabolic state where the body shifts from using primarily glucose as its primary fuel to using mostly fat and ketones. And that's very different than simply eating better carb sources. It's a clear physiologic shift that has proven clinical benefits in multiple conditions, none of which that were really mentioned in the New York Times article. So ketosis significantly helps improve blood sugar control in both type 1 and type 2 diabetes and can lead to drug-free remission for type 2 diabetes. It's an established treatment for PCOS and fatty liver, conditions rooted in insulin resistance, and it's also a powerful brain-based treatment for epilepsy, dementia, and many mental illnesses. These are not just theoretical benefits, they're documented in research and clinical practice every day, and every doctor and clinician should know about them. But in this New York Times article, that context is completely missing. Instead, we get broad statements about how hard the diet is. And that framing can unintentionally reinforce the idea that low-carb diet is uniquely difficult, when the honest truth is that in modern society, any diet is hard to follow. Ask someone who's tried a strict vegan diet or a very low-fat, calorie-restricted diet or any weight loss protocol that forbids comfort foods, and they'll tell you adherence is challenge. It's a challenge no matter what the diet. Yet the article doesn't ask whether those diets are hard for people to follow. They just seem to imply that a keto diet is somehow the only hard one, which is incredibly misleading and dangerous. So imagine for a moment, okay, just imagine someone is considering adding a ketogenic diet to their treatment regimen for their treatment-resistant depression that they've had for a decade. But then they read in the New York Times a quote by someone who, by the way, has never recommended a keto diet and has no experience with it, but they read how this quote-unquote expert says it's too hard to maintain. So what do? Well, they decide not to try it before they even learn more because it's going to be too hard. Can you imagine what an incredible disservice that is for that individual? Yet it happens all the time. And that doesn't mean that everyone should try a ketogenic diet. But at the same time, we absolutely shouldn't scare everyone off a ketogenic diet because we know so many could benefit from it. And for many, it's not hard at all. And then what about the idea that carb quality is all that matters and not quantity? Well, there's definite truth that eating whole grains or steel-cut oats or fruits are less of a concern than refined and highly processed carbs, no question. But for someone with advanced metabolic disease, even these foods can trigger dramatic blood sugar spikes that worsen insulin resistance and metabolic dysfunction. Luckily, with a continuous glucose monitor, we don't have to guess anymore. We can all see for ourselves what the healthy whole grains do to our blood sugar, and I guarantee you, many will be quite surprised. For these individuals, simply focusing on carbohydrate quality is not enough. They can dramatically benefit from addressing carbohydrate quantity too. But when you don't interview anybody without experience, you don't get that side of the equation. So here's the balanced truth. Not everybody needs a ketogenic or low-carb diet. But for many people struggling with serious metabolic diseases or brain-based disorders, ketogenic therapy can be a safe and effective option to restore metabolic health, especially when other approaches haven't worked. So we absolutely need thoughtful and responsible journalism about nutrition. We need journalists to engage with the full spectrum of clinical expertise, especially from clinicians focusing on metabolic therapy. That means talking to doctors, dietitians, and researchers who know about the clinical uses of ketogenic diets, not someone who swears they never have and never will recommend one. What kind of balance are you going to get there? It also means presenting the challenges and benefits fairly, so that people can make informed decisions about their own health. Yes, for some people, ketosis, ketogenic diets are very hard, and for others, it's not hard at all. So if you're exploring low-carb or ketogenic therapies, please don't read the New York Times. Instead, talk with a clinician familiar with these approaches. And if you're looking for a place to start, check out metabolicmind.org, where we have content to help you get started and where we link to many other resources and individuals in this space. And you can even check out our Think Smart section, where individuals share their personal journeys. And please leave us a comment on your thoughts and your journey, as we love to hear from you. So thank you for watching. I'm Dr. Bret Scher, and we will see you here next time at Metabolic Mind, a nonprofit initiative of Bazooki Group.